everyone, I am Dr. Gayatri Mukhe. I am a pediatric dentist and we treat children who are under our care right since birth till adolescence. The common oral habits which can turn out to be harmful for the child will now be discussed. Now, when we start with something as simple as thumb sucking, it is generally to be ignored till 3 years of age, and we suggest that the parents do not pressurize the child to try and remove the thumb from the mouth. But if the same thing persists beyond 4 years of age, it causes various problems like protruding teeth, a lisp during development of speech, and the lower jaw to be rotated in such a way that the face appears longer than what it is. This leads to a problem called as adenoid facies, which can result in ear, nose and throat related problems later on, and also cause a problem in the alignment of teeth in the oral cavity. The second most common problem that we see is bruxism, which is in easier words clenching or grinding of the teeth. The most common reason for this is psychological issues wherein the child may be disturbed due to a change in environment or circumstances at home. The treatment for these being observation and psychological support before any dental measures are undertaken. Now, commonly for some children having special healthcare needs, the grinding might become so severe that they might end up with severe dentinal hypersensitivity, causing them to hyperreact to foods which are very sweet or very sour. Now, in such cases, we might need a more extreme form of treatment wherein root canal treatments and crowns are advised to ensure that the teeth do not wear off. In addition to this, a soft splint can be given to prevent pain in the joint of the jaw, which is the temporomandibular joint. The third most common problems which are seen is lip biting and frenum thrusting. The frenum is a fleshy structure which connects the lip to the gums and the tongue to the floor of the mouth. Now, when the frenum is tight and short, or it can cause any form of irritation to the child, they end up in a habit called as frenum thrusting, wherein this fleshy part is pulled between the gaps of the teeth, causing injury to that area. Now, when this frenum is tight near the tongue, the child is unable to move the tongue correctly, because of which they also end up developing speech related issues. So before a child is diagnosed and to be treated for a speech disorder, it is important that the child is seen by a pediatric dentist to determine if they have a problem called as tongue tie or ankyloglossia. Now, tongue tie may be wherein the fleshy part called this frenum connects the tip of the tongue to the floor of the mouth, wherein the child is unable to protrude the tongue out. Now, this might not be a very severe form, wherein the child is not able to speak certain words containing sibilants well enough, wherein S pronunciation becomes extremely difficult. So, the earlier this is diagnosed, the easier it is to treat. Done in childhood, it is a procedure just lasting for a few seconds, but would ensure that good speech therapy further on will have normal speech development for this child. The next harmful habit is lip biting. Now, lip biting can cause unintentional injury to the lower lip, most commonly affected. The lip contains small glands which are minor salivary glands. Now, if the child continues biting, some of these minor salivary glands can get ruptured and saliva can spread around this area, resulting in something called as a mucocele, which is extravasation of saliva into the surrounding tissues. Now, this problem can continue to recur unless the habit is taken care of. So, this habit also needs persistent monitoring and a device placed in the mouth which would prevent the lip coming too close and being bitten by the upper front teeth, such that extravasation of saliva does not occur into the mouth.